Well, about 6 months after 7 News gave you an exclusive look at a first-of-its-kind robot being used at ECMC for complex microsurgeries, we have now learned that the hospital is using this new technology more than all but 2 healthcare centers in the entire world. ECMC has the 3rd highest volume globally, only behind NYU Langone and Yale. Surgeons say this is revolutionizing how they can treat certain procedures. Today I talked with Dr. Jordan Fry about the difference this is making for local patients. Why do you think it is that ECMC has so sort of embraced this and is kind of like leading the way with this?
Yeah, I think, a few things. I think number one, we've seen a lot of patients coming in from obviously Buffalo and then surrounding areas just with very complex problems that we've built up a team that is equipped to help take care of those challenges that maybe other places aren't as equipped to. And then I think we're all, speaking for all of the surgeons in my group, we like being innovative, we like using new technology, we like being on the forefront of things if it's going to help our patients, and this is certainly something that meets those kind of criteria.
Yeah, and explain to folks how this is helping those patients, how it's leading to better outcomes in most situations.
Yeah, really this microsurgical robot, it allows us to be so much more precise with our movements. And if you can imagine, we're either connecting blood vessels or lymphatic vessels that are 1-2 millimeters or sometimes even less in size. And we're using these sutures that sometimes you can't even really see it with the naked eye. And so we're doing all this under a microscope and traditionally with our own hands, which, we're good at, but there is a limit to how fine you can get, how precise with your movements. And this microsurgical robot, when we're able to bring this in and then handle it remotely, to be able to have movements that have no tremor at all, which, even the least tremored hands always have something when you're on that small a scale, and to be able to move and bend in these certain ways, to be able to place the sutures just exactly how they need to be, to make sure that these, if they're blood vessel connections, that they work and continue working for, the patient's lifetime. Or if they're a lymphatic reconstruction, that you're doing something that is inherently unnatural. You're connecting a lymphatic vessel to a vein, and so you have to do that in a very precise way to make sure it stays open and can actually help reverse the effects of lymphedema that the patient are experiencing. So this robot allows us to really do that with a lot of confidence.
Dr. Fry pointed out that the number of American hospitals using this technology has doubled just over the past 6 months or so. He thinks that trend will continue. At ECMC, the 2 most common uses for this are lymphedema, which he referenced there, and then also reconstruction following mastectomies for breast cancer patients.